I think it's just the helping people and at the end of your day knowing you made a difference.
She may not look like Wonder Woman, but Jenna Maycock definitely resembles a superhero.
I have 2 children, ages 1 and 4, and I'm 5 months pregnant with our 3rd child, as well as I take university classes towards a degree and then working 12-hour shifts. And I have a husband, and besides that, you have to fit in your own time and social time. It's like a juggling act from start to finish.
Much like a superhero, Jenna dedicates her time to protecting the public. She's a licensed practical nurse working in the emergency room at the Fraser Canyon Hospital in Hope.
Working in emergency, that's the area that I love, and I've worked in all areas from surgical to extended care to emergency and medical. But emergency is the adrenaline and the fast-paced environment. You know, you have your stressful days, but then at the end when you hear someone thanking you because you made a difference in their life, it totally makes up for all the bad things that do happen.
Nursing is a lot different today than it was 20 years ago. Jenna's only real complaint is that sometimes the workload can trump bonding time with patients.
You have way more patients' responsibilities, paperwork, so you don't get that one-on-one time and that bedside time with patients, so you don't really get to know them as much as you wish you could, so I think that's the most challenging part.
Although Jenna works at Chilliwack General Hospital and the Fraser Canyon facility, she definitely has a soft spot for Hope.
I think people don't even realize there is a hospital in Hope, that that you can even go to one. So, and for the entire hospital, including emergency, there's only 4 nurses.
Hope is a small community, so you get to really work well with the doctors, the nurses, and you get to know everyone. Because we have less people working here, everyone has to work together more closely.
Often faced with complaints of long wait times or generalizations about nurses sitting around all day, the team of healthcare professionals in Hope feels sometimes their hard work goes unrecognized.
Nurses take care of people at their worst, and we have to see people in every aspect of life, and it's a difficult job, so I think that we are overlooked at times.
Some people have a really bad experience with a nurse and they made a really negative, impact on them, but they have to understand they're people too, and we're only human, so they don't know why that nurse has had a bad day. She could have had a patient that just passed away an hour before, and she hasn't had her break in 8 hours. So I think people don't really understand that we're wives and girlfriends and moms, and we have a life besides work, so they don't always understand that part. So, and I think when you are sick in hospital and you experience that really great nurse that made a difference on you, that changes your look on it.
Although Jenna doesn't possess any superpowers, her everyday efforts to care for patients and her family are heroic. For Shaw TV, I'm Corinne Skelbeck.